You're listening to the Health and Happiness Podcast with Travis Kemper and
Lauryn Maxwell. Each episode, we share easy to implement strategies to improve your health, happiness, and overall quality of life. Technically, I'm still young, but according to my back pain, I'm 93. Unknown. How's it going, Travis?
Good. Well, the basement's on hold. We're waiting for government inspections now. So I'm kind of stuck there. We'll see. We'll see when the city can come. My new job is so much better. The reward to documentation ratio is amazing. Yeah. Helping people who are like normal members of society, like you're out and about, you're working, you're taking care of your kids. Helping them get out of pain is incredibly rewarding intrinsically, and I am loving it.
That's so awesome.
Another benefit of my job is I have real health insurance for the first time since I was, 24. So for the first time in a decade. Yeah, so I went to see an allergist, and he thinks I might have some exercise-induced asthma because of some of the symptoms I'm having.
What? Wait, what symptoms are you having?
Well, the biggest one is when I go hiking in the mountains, I can't breathe and then I vomit. I don't think it's asthma.
Every time?
In the winter, yeah. Yeah, at least once a week I vomit. Because like I don't think it's asthma. So what happens is I get out there.
Doesn't sound like asthma.
Something really bothers me and I clear my throat. That's because I always have drainage down my throat. But that gets way worse in the winter for whatever reason here. This is the worst place I've ever had.
Wow.
Yeah. And then I get so much that I start gagging, and eventually if you gag enough, you end up vomiting. Yeah.
Oh my gosh, I had no idea that happened to you. I'm sorry.
Well, now everybody can know. Yeah,
you've been exposed.
Yeah, so he's never heard of this. So we did the testing on the first day. He gave me a bunch of ideas. I've done some of them, but I don't like to change a whole bunch of things all at once because
it's hard to actually know what is helping.
It's hard to know what's happening. Yeah. And then he gave me 4 medications that he wants me to take, and I'm not doing that. So
that's a lot of medication. Wow.
Yeah. So we'll talk more about that next visit in a week and a half. But yeah, I changed one of my medications because he thought that it would be better. My just general over-the-counter allergy medicine. And I'll probably try one of the other ones, but I need to do some research on the side effects and stuff like that.
Interesting. Wow.
Yes. So we're getting that. Also, we're going to replace the carpets in the upstairs part of my house sooner than we were anticipating. So maybe putting the basement on hold is not the worst thing in the world because if you know anything about carpets, they're absolutely disgusting. Just in general, they hold pounds and pounds of dirt and dust, and that you cannot get out. So these are really old and grungy. So we were going to replace them anyway, but we were thinking maybe getting rid of carpet and just putting in, tile or laminate or something will help my allergies quite a bit. So we're going to do that sooner, but we're not going to rush it because I don't want to be, I don't want my life to revolve around my house. Anyway, I've done that before. It's not fun. You saw me when I did that.
I did, yeah.
How's it going with you?
Nothing quite as eventful as what's been going on with you, but this last Thursday was my birthday. I am officially a 32-year-old lady.
Happy birthday.
Thank you. So we've just been kind of celebrating and spending quality time together, which has been really fun. My birthday tradition that we've had since I think Nolan and I have been living together, which is probably 10 years now, is putting up and decorating our Christmas tree while listening to Pentatonics Christmas music, which if you don't know Pentatonics, I would encourage you to go listen to them. They are, I mean, it might not be everybody's style. They're an a cappella group, but their Christmas music is like next level. They came out with a new album, Christmas album this year, and I think last year too, and I hadn't heard either of them. So when I was listening, there was one that came on while we were decorating the Christmas music that was just like so overwhelmingly beautiful that I just started crying. It was like, oh, it was so perfect. But anyway.
Well, I will let you know that I don't like Christmas music very much.
I don't like traditional Christmas music.
And because of you, my wife is going to make me listen to more Christmas music this year because of this podcast. So thanks.
Wait, what?
Well, she's going to listen to this and she's going to be like, we have to try it.
Oh, you're welcome for the future, Julia. Listen to Pentatonics. It's good. It's like the best Christmas music.
We will probably give it a try because she won't make me.
Nolan doesn't like Christmas music either. He puts up with the one that I listen to though. Anyway, so just feeling really grateful because I get really like reminiscent and nostalgic around birthdays. And I spent probably the whole like night before my birthday looking through all of my pictures that I had taken over since I had a camera, which is like since high school. And I was just like looking through all these pictures of like friends and good times and became very, very grateful for all of the like people in my life, including you, Travis.
Oh, good. I'm glad you got to listen to your Christmas music on your birthday.
Yes. So what are we going to talk about today?
Lauryn, have you ever had back pain?
Yes. I feel like everybody has had back pain.
Maybe. How is it?
Terrible. It is terrible. The one that I like specifically remember, there's been like, I think two events of back pain, significant events of back pain in my life. And one of them was during PT school. And I remember it was so painful that I like was holding my breath to do pretty much anything, like any type of exertion. I was like bracing, and I like didn't want to get up from laying down. Like I just wanted to lay down. But like in PT school, you're like manipulating each other and like doing all these weird things, trying to learn how to like treat people. And I remember just being like, this is the worst thing I could imagine right now. Because we weren't treating my back pain. We were like unrelatedly doing other things, and it was horrible. Anyway, what about you?
Yeah, well, I mean, I don't think I ever had back pain ever until 2 years ago. I had like back soreness from exercise, lifting weights, or like doing yard work or something like that, where the muscles are actually sore, and that's a pretty miserable experience. But you know it's going away because I get soreness every day. But I had a brief episode of back pain about 2 years ago after a jiu-jitsu class, and it provided a lot of insight into my patients' complaints. I was miserable. For the first day, I remember I couldn't sit in a chair. I had to do, a chair push-up. Obviously, basically for anybody that's like, what the heck's a chair push-up? You're just pushing down with your arms to lift your bottom off the chair. I had to do that to sit comfortably, which gets very exhausting on your triceps.
Yeah.
And I laid on the floor pretty much the first day, and just did like soft movements into the pain-free range, because I could not sit. I couldn't do anything but lay on my back without significant pain. So
it's horrible.
Yeah, it was awful. And I got rid of it in like 4 days. So that was good. But it like I said, it provides some significant insight into what my patients are going through and why they shift in these weird ways when they are experiencing this back pain. So anyway, prevalence of back pain, it's extremely prevalent. It's one of the most common things for people to report to a physician. Nearly 65 million Americans reported a recent episode of back pain, and 16 million adults, about 8% of all adults, experience persistent or chronic back pain, and as a result are limited in certain everyday activities.
And that was from 2002, so it probably has increased since then.
Probably has increased with obesity and more sitting.
Yeah. It is actually the number one most costly condition each year. 134 billion each year is spent on direct healthcare costs, and that doesn't include the economic costs of missed work and all of that stuff. It is a very costly thing on the healthcare system. For causes, like what causes back pain, it's hard to say because the science behind imaging is pretty bad historically. And still a lot of times they use imaging to diagnose the cause, even though there is substantial evidence against this use. We found an article where evidence shows that unnecessary or routine imaging, such as X-rays, MRIs, and CT scans for low back pain, is not associated with improved outcomes. Imaging can also expose patients to unnecessary harms, such as radiation and further unnecessary treatment. For the majority of individuals who experience severe low back pain, pain improves within the first 2 weeks of onset.
Yeah, and the findings on some of those other studies about CT and MRI images, the findings are very similar in the painful population to the non-painful population, which we'll go over here in a little bit to go a little more in detail, and I'll share a
graphic.
Graphic and a summary of a study that really and truly everybody should read, because it's not even just for back pain that these are problems. I was reading something I have a private patient coming in on Wednesday that he is having bone spur in the shoulder, is what he was told. And this is a very active man in his prime mid to upper 50s. He's having a bone spur in his shoulder, and they told him that he needs a shoulder replacement. Well, if you get a shoulder replacement, you can't lift weights anymore. When I say very active, I mean this man lifts weights, and pretty heavy weights. And
that's like gonna ruin his life.
I'm like, man, you really we should talk. We should see each other before you would go through this surgery. And luckily he's not on board with just jumping into the surgery. But I was like, this is going to completely change his life, and possibly for no reason. So I looked up where these imaging studies are showing what is on a painful patient to what is on a pain-free patient. Can't find much on the shoulder yet. This is all new science with back pain. They're just starting to do this maybe in the last, I'd say 15 years now. This has become more popular to look at. I can't find it on the shoulder, but the shoulder is very similar to the hip. And there are studies that show that in pain-free patients, 72% of pain-free patients have bone spurs on their hip. So since they're very similar joints, I'm going to presume that eventually we will have the same study on the shoulder, which means that bone spur, maybe it is causing his pain, maybe it isn't, but it's probably not. We probably shouldn't just jump into a major surgery that's going to completely change this man's life.
Right. Absolutely. Especially if there's other ways that you can treat that as a physical therapist.
Should at least explore them.
Should at least explore them before jumping into a life-changing surgery.
And they literally told him that there's nothing he could do. They told him that exercise won't work, therapy won't work. This is what the surgeon told him. And I was oh my God.
That's really frustrating.
I was like, so I'm really hoping that I can provide him pain relief right up front. And
that would be great.
Show him.
Then you'd have buy-in.
That's probably, yeah. So we'll see what his shoulder looks like when I actually get there. Anyway, so back to the back pain. So we had talked in previous episodes about nocebos, placebos, and the power of words. I think there were episodes 14 and 15. Those are specifically the episodes that we talked about these type of things and how the words that a healthcare professional uses can completely damage a person. And also the belief in this diagnosis can completely damage a person. So I think I shared in one of those episodes, I'd be shocked if I didn't share, about my patient who had not walked in 3 years, I think it was, because a surgeon took an MRI of her back, looked at it and said, your back is so messed up that you should not walk. And she believed it and sat in a wheelchair for the next 3 years until I met her and I told her that's the dumbest thing I've ever heard. And we got up and walked that day.
That is so, yeah, I remember you telling me or telling the podcast that story. That's
so
horrible.
sad.
Yeah, because like in our episode on how words matter, we mostly talked about how like your words matter and other people's words matter. But like a person of authority, a person who is supposed to like know better than you, that is severely damaging.
Yes, and for the older population, like this woman was in her 80s, they were brought up, they really believe things that physicians say and surgeons say. They view them as authoritative, very knowledgeable people. And that's not to say that they're not. It's just sometimes to say that you shouldn't believe every one of them, because I think we've said this before, 50% of people in any profession are in the bottom half of their profession. So they're not all the greatest. So findings from MRI and CT scans in people with no pain. So they took 3,110 healthy people with no pain. 30% of the people in their 20s, Lauryn, that had no pain had disc bulges. 35% had disc degeneration. This is in the 20s and your discs are already degenerating. When we go up in age, all of these things get worse. In the decade of people with in their 80s, Jesus, that was tough. In your 80s, 100% of people with no pain had disc degeneration, and over 80% had disc bulges. So this is a 2014 study. Like I said, this is pretty much the last 10 to 15 years that people are starting to look at this and questioning why we're not getting the results we should when we know so much about the back. And if you're not watching, I just put "no" in quotation marks. So I strongly recommend you all go to that link. We will put it in the show notes. You can click on the link. It's the nextstephealth.com link. And you can see the pictograph of where they show, it's just a bar chart of all of these problems in the back that they blame, and they say, you know, this is the cause of your back pain. And now we legitimately know that you cannot diagnose back pain to a specific issue 95% of the time or more.
Yeah, I remember we looked at this study in PT school, and like, I don't work in this particular part of the field, so I don't deal with back pain a lot in my professional career. But I remember when I learned this, it was like mind-blowing, because everybody, I think at that point that I lived in a very like old town. A lot of the people in it were pretty geriatric age. And so most of the people that I grew up around had imaging of something going on in their back, and they were all they kind of had accepted that they were going to be in pain for the rest of their life. One of them being my dad. My dad had, I think when he was really young, maybe in his 30s, had an injury and then had gotten imaging for it and had found that he had a bulging disc. And he had pretty much accepted, he's how old now? Somewhere in his 60s, but he had accepted that he was going to be in pain for the rest of his life. And that, like, he'd already been in pain for 30 years. And as I was going through PT school and looking at this study, I called my dad immediately and I was like, Dad, you need to go to physical therapy. Like, you have back pain and you've just accepted that you have back pain, but that acceptance is not your reality. You're just, this imaging has you thinking that this is going to be the case, and that's not the case. He went to physical therapy and he has been pain-free.
That's
after
awesome.
30 years of pain.
Yep. That's awesome.
Incredible.
Yeah. That goes back to what I said in the very beginning about how rewarding my job can be.
Yeah.
Because you can get him out of pain, and it's so great. And it doesn't always work, but I have a fairly good track record. So looking at prevention, we looked at a study. They followed 4,882 patients. The mean age was 65 years old. So these are mostly older patients. They followed them for 4 years, and they wanted to examine what lifestyle changes can you make to avoid back pain. That was the goal of the study. And what they did was they had these patients self-reported, where they did no physical activity at all, moderate physical activity, or vigorous physical activity, and how many days per week. And what they found 4 years later was that the results showed that maintaining moderate or vigorous physical activity at least 1 to 3 times a month was negatively associated with prevalence of low back pain compared with no physical activity at all. So in other words, exercising prevented the back pain in substantial ways. So yeah, exercise. It's literally the most important thing you can do.
For so many different things.
Yeah.
So more ways to avoid back pain. There's, a pretty long list of things you can do. Number one on that list, again, being get more exercise. Watching your weight. There's a strong correlation between back pain and being overweight or being obese. Stop smoking if you smoke. Smoking can restrict the flow of nutrient containing blood to the spinal disc. So smokers are especially vulnerable to back pain. Get some good sleep, and sleep in like positions that help your body not be in pain. It's not correlated?
No.
Oh.
Sleep in whatever position you can get sleep in. Sleeping is the most important. Yeah, in the studies, it's not correlated. No position.
I had no idea, but
yeah, that's because you work with babies.
Well, yeah, but it definitely hurts my back if I don't put a pillow between my knees on my side.
Right. So you should do that because you need to get in the position that you can sleep and sleep well. But yeah, the studies don't show correlation between what position you're in and back pain. Yeah, it's just like the correlation is no sleep or lack of sleep causes back pain.
Oh, well, there you go. Get some good sleep.
If you're getting pain in a position, get the hell out of that position. You need to sleep.
Sleep well. Make sure your workspace is ergonomic. So if you're at a desk and you have a computer in front of you, making sure that computer monitor is centered in front of you and the top of the screen is just above eye level. And then your keyboard is in a good position for your shoulders and wrists. A lot of people have their keyboards up higher, especially if you're on a laptop, which I am. Not a perfect position by any means, but save longer messages for a computer rather than typing them on your phone. If you're typing on your phone or even just browsing on it, I'm pretty sure everybody's noticed you tend to have you move your head forward to look at your phone, which rounds your spine even more in an even more exaggerated way. Take lots of breaks every 10 minutes or so, stand up or stop typing and stretch. And after every 20 minutes, spend some time away from the computer. Just get up and move your body, basically. Don't just sit for hours on end. Be careful of how you lift. Don't bend over from the waist to lift heavy objects. Bend your knees and squat, pulling in your stomach muscles, tighten your stomach, and use your core, and hold the object close to your body as you stand up. Let your legs do the work, not your back. Some of these other ones I had not heard of before, like avoiding high heels. I don't know if there's actual studies on that, but
I don't either. I don't wear high heels though.
I don't either.
They look really uncomfortable.
They look horrible. I've worn high heels maybe 10 times in my life, and I don't enjoy them.
Yeah, I think I'm going to stick with my sneakers.
Yeah.
I would say, yeah, this list of things that Lauren's going through, this is all from WebMD. So we just kind of took theirs and threw it out here. I would change this if it was me. I would change this from avoid high heels to wear quality, comfortable shoes. Because I notice a difference in my feet and in just my overall body and my energy. If I'm wearing crappy shoes versus I buy, I'm frugal, but there are certain things I spend money on, and one is my shoes. I spend big money. I buy very high quality running shoes, and that is what I wear every day to work. And it costs me over $100 a pair. And I've been buying them since I was in PT school because it's just changed my life.
Right. Yeah. If you have not great shoes and you spend all day on your feet, like, you feel that.
Yeah. And I would be shocked, though, if there is not research around high heels and how bad they are, because depending on your profession and where you live, women will wear high heels every day, and 8 hours a day at work. You think of places like New York City.
Can't imagine.
That
was always my goal.
They look uncomfortable.
That was always my goal when I was growing up. I was like, I want to get into a profession where I don't have to wear high heels to work. Like, no, thank you. Hard pass.
That was your goal.
Yeah.
Well,
when I was like a little kid and I didn't have a good idea of what I wanted to be, I did not want to wear high heels.
Mission accomplished.
Yep, I got it. It's great. Take your wallet out of your back pocket when you're sitting, especially if you're sitting for a long time, like when you're driving, because that can lift one side of your hips higher than the other, and that changes the angle of your back. Be conscious of your choice of a handbag or briefcase. If you're carrying a briefcase or a heavy bag without like a big long strap that you can sling around your body to disperse the weight, switch sides so you're not like leaning to one side.
Julia uses a phone wallet. That's all she carries is her keys.
Oh yeah, me too.
You do the same thing? Yeah, she just carries her keys and her phone. Yeah. And her case has, her ID and a couple cards.
Yep.
So that she can function as an adult.
Yeah, that's how mine is too. I hate purses. I hate them.
I don't do those either.
Surprising.
My wallet sits in my car all day. I probably shouldn't tell people that, because if you see my car, you could steal my wallet.
Don't do that.
It's pretty much in my glove box all the time, because I don't want it around. I don't want it under my butt.
Right. Yeah.
I'm not going to sit on it. So
yeah. I just recently, because there's very few times that I like have needed a purse, because like Julia, I just carry like it's a cell phone wallet. But if I need more space to carry things in, I just recently switched to like a small backpack, because I refuse to, like, purses make me like drop one shoulder and slouch. I just hate them. Anyway.
Tangent over.
What?
Tangent over.
Tangent over, yes. There was a note on this WebMD article about back braces, and it says they can be helpful after certain kinds of surgery, but there is not much evidence that they can help treat chronic back pain.
Makes sense.
But that was important enough to mention.
Yeah. If it gives you a placebo, though,
go for it.
Go for it, because it's not going to hurt.
Right.
All right. So treatment, just move. That's really the biggest takeaway here is move. One of the first things I do with patients that come in with back pain is I get them to move. I see what positions help, what positions hurt. Usually this changes if you've been having pain for 30 years, because then you just perceive everything as painful. Sure. And it's so intertwined in your brain that you're just having back pain that you don't even notice it. But if you've only had pain for a little bit, a lot of times what I'll find is twisting one way or the other will completely eliminate your pain, while the other way hurts like heck. Mm-hmm. Bending forward versus bending backward, same thing. One way will hurt, one way will feel like really good and completely take away your pain. I had a patient who's had years of back pain this week. come in. She actually works at our, she doesn't work at my facility, but she works for my company. And she told me she wasn't going to come in. She started to have radiating pain down the front of both of her legs. This was started about 2 months ago. She didn't want to come in, mostly because of financial worries. Our insurance is great, but she has to take some time off work to get to see me. So she wasn't going to come in at all. She came in. She didn't think I could help her. Right away, we're starting off good. And literally in the first couple minutes, I did a real quick back screen. I had her bend forward and she was completely out of pain. And she was like, what the hell? Because when you've been in pain for so long, you don't, like, that's a shocking feeling when you get out of pain. And I won't get to see her again for 3 weeks because of her schedule, but basically what I had kind of ingrained in her by the end of the thing was like, if you're in pain, get out of pain using these two techniques that we found, which was twisting to the right and bending forward. That'll relieve your pain in the moment. And then the goal is to restore normal motion. So you move to almost where it's about to start hurting, but it's not hurting yet. And you just keep doing that. And that's exactly how I got myself out of pain in 4 days when I had that serious painful event after jiu-jitsu. In a study on PubMed, in modern Western society, sedentary behavior has become a growing health concern. There's increasing evidence that prolonged sitting periods can be associated with musculoskeletal disorders. Now there's growing evidence that staying in one position causes pain. So if you're just in one position all day, you're going to be in pain. You need to change your position. Right. So that's basically what they investigated. They just didn't say it the way that I liked it. So I changed it. The study investigated the effects of regular muscle contractions on muscle stiffness in a controlled experiment in which patients sat for 4.5 hours. Lauren, this is another study I would never sign up for.
Nope.
You'd have to kill me.
Nope.
So basically what they found was the prolonged sitting period, staying in the same position without moving, significantly increased back muscle stiffness. And they were able to show that regular muscle contractions, so just changing positions while you're sitting for those 4.5 hours, can prevent those effects. These results highlight the importance of consistent muscle activity throughout the day and may explain why prolonged periods of chair sitting increase the susceptibility to common pathological conditions such as low back pain. This is a really important study because so many people sit for 4 hours at their computer and then get up for lunch for a little bit, if they even get up, because I know a lot of people that don't move at lunch. Yeah. They just eat at their desk and then they're sitting for another 4 hours. I try and encourage people at your lunch, get up and go for a walk outside at the very least. I exercise every day at lunch. Oh, God, I love it. It's one of the big benefits of being in a gym.
Yeah, that's really nice. That is definitely not something I have access to.
Yeah,
most of the time.
You can go outside and take a walk.
But I can go outside and take a walk. I'm walking most of the day though, so sometimes I actually take the time to sit down and eat.
Right, there you go. And if you're active all day, that's fine.
Yeah. I mean, with our profession, we're usually very active throughout the day. I'm running to get kids and then working out with kids all day, which is awesome. I love my job. That was one of my other goals when I was young and didn't know what I wanted to do, was no high heels and not sitting at a computer.
There you go.
Nailed it. Anyway. We also looked at a study about how yoga can help. So this was a meta-analysis that looked at evaluating the efficacy of yoga as an intervention for chronic low back pain. There were 8 randomized control trials in the study with 743 patients. The results of the study indicated that yoga may be an effective adjunctive treatment for chronic low back pain. And the strongest and most consistent evidence emerged for short-term benefits of yoga on functional disability. So they found that it helped in the more short term.
I love yoga. I don't do it enough, but people should do it a lot. It's
Same.
really good for you.
Yeah, I don't do yoga enough either, but I like it.
Yeah, I'm working on that. That'll be a new habit coming next year to get back into
Nice.
to doing yoga more often. 2021 systematic review showed that exercise is effective for reductions in pain and disability when compared with a placebo, usual care, or waiting list control, and serious adverse events are rare. So exercise was better than usual care in reducing pain and disability. And it was also better than a placebo, which is good because we know that placebos from that episode can sometimes be insanely powerful.
Yeah.
So yeah, to beat the placebo is good. And it's just exercise. They didn't even do anything this is systematic review. So they didn't talk about what exercise because they summarized a bunch of different studies and looked at the results. But they found evidence that exercise works, which is consistent with exercise research because exercise works.
Exercise is the best.
Yes.
We also looked at a study that basically is talking about how the professional that you see matters. The purpose of this study was to compare differences in care delivery between high and low performing physical therapists. So they had 1,240 physical therapists that were classified as outperforming, meeting expectations, or underperforming relative to a predicted change in a questionnaire for low back pain across patients receiving care for low back pain. The results showed that clinically effective physical therapists incorporated a consistent blend of skilled, active, and manual therapy interventions that was distinct from lower performing physical therapists. These differences highlighted a treatment signature that was associated with clinically important improvements for patients with greater baseline disability. So basically, this tells you that exactly kind of what Travis was talking about earlier, and we've talked about before, that there is a difference in the professionals that you see because not everybody is great.
And to put it very simply, Lauryn is going to have way better results with children.
Oh yeah.
Than I'm going to have.
And I mean, clearly you're going to have way better results with back pain patients and this population of people than I will, because I don't practice in this field.
Right, exactly. So that's like the broad way of looking at it. What I think is cool about the study is I haven't looked specifically for these studies, but I haven't come across these studies either that are comparing good and bad and like showing you that your provider freaking matters.
It freaking matters.
It matters a lot. So if you are not getting results from your physician, your physical therapist, your chiropractor, whoever, if you're not getting good results, don't necessarily write off the profession, write off the professional.
Yes.
And go get a different one and get a second opinion and see what happens from there.
Yeah, definitely. I mean, I take into consideration the area I practice in a lot because being a physical therapist, you have people come to you all the time with like orthopedic stuff. And I always am like, look, this is not the field that I practice in. I know some stuff, but I don't practice in it. I would rather you go get a quality like assessment by a real not a real physical therapist. I'm a real physical therapist, but a real physical therapist who practices in this part of the field. Because I can only get you so far, and I know that.
Well, I don't have a children's physical therapist to refer to, but nobody else in my practice does kids. So they gave me a kid this week. She's an 11-year-old. She's wheelchair bound. And I looked at what they were doing and I was like, oh yeah, well, no wonder she hates this, because this was the first thing she told me. She's like, I don't want to come here. My parents make me. And she's a real cool 11-year-old. But they were trying to make her do like dumbbell lifts and stuff. And so I made her laugh for 45 minutes. It was fun. She's a cool little girl. And next time we're going to have an obstacle course. So I'm going to probably have to like come up with some things with you because I don't do this very often, but I thought of one really cool one. So we're going to bounce a ball off a rebounder. There's going to be a target which she has to hit. And then she's going to do some like wood chop exercise, some normal exercises, but we're going to mix them in with the fun. Then she's going to do a 360, grab a Nerf gun and shoot a target on the wall. And that's as far as I've gotten so far.
I love it. I love it. That's like the best part about working with kids is you have to turn everything that you want to do into a game.
Yeah. So I figure that will take up approximately 6 minutes of the 45 minutes. So I've got 6 minutes of good dreaming right now. And I've got to work on the next 39 before Thursday when I see her again.
Yeah. You got a good start though. We can talk about it and then come up with some ideas. It'll be fun.
Awesome. Well, this was fun, Lauryn. You did a great job today.
You did a great job, Travis. Thank you for sharing your expertise in this part of the field because you taught me some things today I didn't know.
Yeah, well, you don't work in this part of the field. You would learn them very quickly.
Oh yeah, if I did, I would learn them quickly. I just don't need to at this point.
No, you don't. Thanks everybody for listening, and we'll see you next week for another episode of the Health and Happiness Podcast. Please give us a review if you have not. And I think, are we talking about habits next time?
I think so.
All right. We just committed to it. We're talking about habits next time.
We'll see you next time.
Bye.
Bye.
Thank you for taking the time out of your busy day to listen to this episode of the Health and Happiness Podcast. We hope you enjoyed the episode and are getting benefits from our content.
If your life is improving in part due to the information in this podcast, we would greatly appreciate you sharing the episode with your family and friends on social media and leaving us a review so we can continue to reach more people and improve the health and happiness of the community at large.
Thanks again, and we will see you next week for another episode of the Health and Happiness Podcast.